Rub this oil on your skin. Every night, here is what really happens to pain, inflammation, and aging. I am Dr. Dylan. I want to start with something that happened in my clinic about 4 months ago that completely changed the way I think about this topic. A patient of mine, 71 years old, retired engineer, someone who had been managing chronic knee pain and hip stiffness for years, came in for his routine appointment and something was immediately different about him. He was moving more fluidly. He sat down without the careful, guarded movement I had watched him use for 2 years. And when I asked him what had changed, he told me he had been rubbing a specific oil on his knees and hips every night before bed for about 6 weeks. He expected me to be skeptical. Most doctors are. But when he told me which oil it was, and I started thinking about the actual biology of what that oil contains and what those compounds do when they penetrate the skin, I was not skeptical at all. I was genuinely interested, and today I am going to share that with you. My name is Dr. Dylan. I am a physician with over a decade of clinical experience, and today I am going to tell you about the oil that research suggests can meaningfully reduce pain, lower skin and joint inflammation, and visibly slow the signs of skin aging when applied topically every night. What it is, exactly what is in it that makes it work, the correct way to use it, and what to realistically expect over time. Please stay with me until the end, because I am also going to tell you about 2 oils that millions of people are using on their skin every night that are actually making inflammation worse. You need to know what they are. The oil I am talking about is extra virgin olive oil, and I know what some of you are thinking right now. Olive oil. That is in my kitchen. That is what I cook with. That seems too simple, too ordinary, too available to be genuinely medicinal. And I understand that reaction completely. But I want you to set it aside for the next few minutes and let me walk you through what extra virgin olive oil actually contains. Because when you understand the specific bioactive compounds in this oil and what they do inside your skin and your joints when applied topically at night, ordinary is not the word that will come to mind. Extra virgin olive oil contains a compound called oleocanthal. Oleocanthal is a phenolic compound that was identified in the early 2000s when a researcher noticed that swallowing fresh olive oil produced a distinctive irritating sensation in the back of the throat, the exact same sensation produced by swallowing liquid ibuprofen. He pursued this observation and discovered that oleocanthal inhibits the same enzymes that ibuprofen inhibits, specifically COX-1 and COX-2, the enzymes that produce prostaglandins and the inflammatory cascade that drives pain, swelling, and tissue inflammation. Oleocanthal is a natural ibuprofen analog. Its anti-inflammatory mechanism is pharmacologically identical to one of the most widely used anti-inflammatory drugs in the world. And when extra virgin olive oil is applied topically to skin over an inflamed joint or painful area, the oleocanthal penetrates the skin and delivers this anti-inflammatory action directly to the underlying tissue. Beyond oleocanthal, extra virgin olive oil contains hydroxytyrosol, one of the most potent antioxidants found in any natural food substance. Gram for gram hydroxytyrosol has an antioxidant capacity that exceeds vitamin C, vitamin E, and resveratrol. When applied to skin, hydroxytyrosol neutralizes the free radicals that drive oxidative skin aging, the same oxidative damage that causes wrinkles, uneven pigmentation, and loss of skin elasticity over time. It also contains squalene, a lipid that is naturally present in human sebum and that makes olive oil extraordinarily compatible with human skin. Squalene penetrates the skin rapidly, restores the skin's lipid barrier, improves moisture retention, and has its own antioxidant properties. And it contains oleuropein, tyrosol, and multiple other polyphenols that contribute to anti-inflammatory and antioxidant effects that research is still fully characterizing. Now let me explain specifically what happens when you rub extra virgin olive oil on your skin every night. Because the mechanism of topical application is different from dietary consumption, and understanding it helps you use it correctly. When you apply olive oil to skin, the lipid-soluble compounds, oleocanthal, hydroxytyrosol, squalene, and others, are able to penetrate the skin barrier because they are chemically compatible with the lipid layers of the skin. This penetration happens most efficiently when the skin is warm and when a gentle massage motion is used during application, both of which increase skin permeability and blood flow to the surface layers. Once through the skin barrier, these compounds reach the dermis, the deeper layer of skin where collagen fibers, fibroblasts, and the microvascular network are located. At this level, oleocanthal inhibits the local inflammatory, signaling that drives chronic skin inflammation and joint inflammation in nearby tissue. Hydroxytyrosol neutralizes reactive oxygen species that are damaging collagen fibers and accelerating skin aging. Squalene integrates into the skin's lipid layers, strengthening the moisture barrier and reducing transepidermal water loss, the process by which skin loses moisture to the environment that drives dryness, flaking, and the tight, uncomfortable feeling of aged skin. For joints that are close to the skin surface, knees, fingers, wrists, ankles, elbows, the oleocanthal and other anti-inflammatory compounds reach the periarticular tissues, the tendon sheaths, and the bursa surrounding the joint. The result over weeks of consistent nightly application is a reduction in the local inflammatory load around the joint that manifests as reduced morning stiffness, reduced aching at rest, and improved range of motion. This is not a dramatic, immediate pain relief like taking an ibuprofen tablet. It is a gradual, cumulative reduction in inflammatory tone that builds over 4 to 8 weeks of consistent use. Exactly what my patient experienced over his 6 weeks of nightly application. Let me talk specifically about what consistent nightly application does for aging skin after 60. The 3 primary drivers of visible skin aging that olive oil's compounds directly address are collagen degradation, oxidative damage, and moisture barrier breakdown. Collagen degradation, the loss of the structural protein that gives skin its firmness and resistance to sagging, is accelerated by the same inflammatory enzymes that oleocanthal inhibits. Chronic skin inflammation activates matrix metalloproteinase enzymes that break down collagen fibers in the dermis. By inhibiting the KOX pathway that feeds into this inflammatory cascade, oleocanthal reduces the rate of collagen breakdown, not stopping it entirely, but meaningfully slowing the degradation that accumulates over years. Additionally, the antioxidant activity of hydroxytyrosol and squalene protects collagen fibers from oxidative cross-linking, the process by which free radical damage causes collagen to become stiff, brittle, and structurally compromised rather than flexible and resilient. Oxidative damage to skin is the primary driver of uneven pigmentation. Age spots, hyperpigmentation, the uneven tone that many adults over 60 notice accelerating. The extraordinary antioxidant capacity of hydroxytyrosol, applied directly where the damage is occurring, reduces this oxidative burden on skin cells in a way that dietary antioxidants alone cannot fully replicate, because topical application concentrates the protection precisely where it is needed. And the moisture barrier restoration provided by squalene addresses the third aging driver, the skin dryness and thinning that comes from a compromised lipid barrier in older skin. After 60, skin produces significantly less sebum, the natural oil that maintains the lipid barrier, resulting in the chronic dryness, flaking, and increased sensitivity that many older adults experience. Squalene from topically applied olive oil directly replenishes the lipid components of the barrier, restoring its moisture-retaining function in a way that is chemically matched to the skin's own lipid chemistry. Here is the correct technique for maximum benefit. Use only extra virgin olive oil, not regular olive oil, not light olive oil, not olive oil blends. The extra virgin designation means the oil has been cold pressed without heat treatment, which preserves the full concentration of oleocanthal, hydroxytyrosol, and other heat-sensitive polyphenols. Regular and light olive oils have been processed in ways that significantly reduce these bioactive compounds. Look for oil in a dark glass bottle. Polyphenols degrade when exposed to light, so dark glass packaging is an indicator of quality. Apply it at night before bed, not in the morning, for 2 reasons. First, nighttime application avoids the greasy residue issue, since the oil has hours to fully absorb before you need to be presentable. Second, nighttime is when skin does its most active repair and regeneration work, and having anti-inflammatory and antioxidant compounds present during this regeneration window maximizes their contribution to skin repair. Warm a small amount between your palms, about half a teaspoon for knees and hips, a few drops for facial application, and apply using gentle circular massage motions for 2 to 3 minutes per area. The massage is not just for absorption. It stimulates local blood flow, which brings more immune cells and repair resources to the area, and enhances the penetration of bioactive compounds through increased skin temperature and permeability. For joints, apply directly over the knee, hip, wrist, or finger joint and massage in circular motions following the contours of the joint. For skin, apply to the face, neck, and hands in upward motions against gravity. Now I want to tell you about the 2 oils that millions of people are using on their skin every night that are quietly making inflammation worse. The first is any highly refined vegetable oil, including refined sunflower oil, corn oil, soybean oil, and generic baby oil or mineral oil. These oils are high in omega-6 fatty acids that, when applied to skin and metabolized locally, can fuel the same inflammatory pathways that oleocanthal is inhibiting in olive oil. Additionally, many refined oils contain processing byproducts and additives that are comedogenic and irritating. The second is coconut oil, and I know this one is controversial because coconut oil has been heavily marketed as a skincare panacea. While coconut oil is not harmful for everyone, it is highly comedogenic, meaning it clogs pores. And for many adults over 60 whose skin is already dealing with enlarged pores and compromised barrier function, regular coconut oil application on the face can cause breakouts and blocked follicles that worsen skin texture over time. Coconut oil also lacks the specific anti-inflammatory polyphenols that make olive oil therapeutically valuable. It is primarily a saturated fat without meaningful oleocanthal or hydroxytyrosol content. If you have been using either of these oils on your skin and wondering why you are not seeing the results you hoped for, switching to high-quality extra virgin olive oil is likely to produce a noticeable difference. I want to close by coming back to my patient, the retired engineer whose movement I noticed had changed at his appointment 4 months ago. At his most recent visit, I asked him specifically about the oil. He had been using it for 4 months by then, nightly on his knees and hips without exception. His morning stiffness, which had been lasting 45 minutes, was down to 15. His resting knee ache, which had been a 3 or 4 on a pain scale of 10, was consistently at 1 or 2. He had started walking more because walking was no longer something he dreaded. And he told me, "Dr. Dillon, I almost did not tell you about the oil because I thought you would tell me it was nonsense." And I told him what I want to tell every person watching this video. I follow the evidence, and the evidence on extra virgin olive oil applied topically, the oleocanthal mechanism, the hydroxytyrosol antioxidant data, the squalene barrier research, is real. It is published in peer-reviewed journals, and it is consistent with what I watched happen to my patient over 4 months. Try it for 6 weeks. Be consistent. Use the right oil. Use the right technique, and let your own body tell you the story. I am Dr. Dillon. Hit the like button. Subscribe to Healthy After 60. Share this with someone you love who is managing joint pain or skin aging after 60. And I will see you in the next video. Take care of yourself. Starting tonight. Before I sign off today, I want to address something that I know will come up. And that is the question of whether olive oil applied to the skin can cause any problems or side effects that people should be aware of. Honest answer. For most people, extra virgin olive oil is extremely well tolerated topically, and side effects are uncommon at low application amounts. However, there are a few things worth knowing. Some people have olive or tree nut allergies. If you know you are allergic to olives or related tree nuts, do a small patch test on your inner forearm before applying it more broadly, and wait 24 hours to ensure no allergic reaction occurs. For people with very acne-prone or oily skin, even though olive oil is far less comedogenic than coconut oil, it is still an oil, and for some oily skin types, any additional oil application to the face can contribute to breakouts. If you have oily or acne-prone skin, consider limiting topical olive oil application to your joints, hands and neck, rather than your face. For facial application on dry or normal skin after 60, which is the most common skin type in this age group, olive oil is typically excellent and very well tolerated. One additional practical note: olive oil does leave a slight residue on fabric, so applying it to joints before bed means your pajamas and bed sheets may absorb some oil over time. Using an old or dark-colored set of pajamas for your nightly olive oil routine avoids any concern about staining. Some people apply it 30 to 45 minutes before bed and then blot any excess with a tissue before they sleep. This still allows meaningful absorption while minimizing the fabric residue. And for people who find the scent of olive oil too prominent for comfortable bedtime use, a very small amount of lavender essential oil mixed into the olive oil gives it a pleasant, relaxing aroma, while lavender itself has mild anti-inflammatory and skin-calming properties of its own that complement the olive oil's effects. I am Dr. Dillon. 6 weeks of nightly application. High-quality extra virgin olive oil. The right technique. Your body will tell you whether it is working. I will see you in the next video. One last thought. There is something I find genuinely meaningful about the fact that one of the most pharmacologically interesting compounds for pain and inflammation management, Oleocanthal, has been sitting in kitchens across the Mediterranean for thousands of years. That the people of Crete and southern Italy and Greece, who built their diets around olive oil, and who were observed in the famous 7 countries study to have dramatically lower rates of cardiovascular disease and inflammatory conditions than Americans eating processed vegetable oils, were benefiting not just from cooking with it, but very possibly from applying it to their skin as part of traditional practice. The distance between ancient traditional knowledge and modern pharmacological validation is sometimes shorter than we think. Extra virgin olive oil is one of those places where that distance collapsed completely. The mechanism is real. The evidence is real. And the bottle in your kitchen or your grocery store represents one of the most accessible and affordable anti-inflammatory skin treatments available to you right now. Use it tonight. I am Dr. Dillon. Take care of yourself. I will see you in the next video.